Let's go to our Ottawa Bureau Chief, Mercedes Stephenson, who's working from home. Mercedes, let's talk about the battle over the 3M masks. The Prime Minister was quite restrained with his response to the questions, but there's obviously some tension between the Trump administration and the Trudeau government.
Yeah, so what happened here was that, for those who are just catching up, the president told 3M to stop shipping medical masks overseas to other countries, including Canada. 3M said, we're not going to do that. There would be terrible humanitarian consequences, not to mention the possibility of other countries retaliating. And the Prime Minister was asked yesterday whether Canada might retaliate. And people had speculated he seemed like he might be hinting at that because he'd said, look, we're very reliant on each other. It's not a good idea for either country to start cutting off goods that cross the border because it will hurt the other one. And what hurts the other one hurts us too. There are many, many nurses that leave Windsor every day to go to Detroit and work in hospitals to help patients who are diagnosed with COVID-19. And people went, well, was that kind of maybe a subtle, veiled threat at retaliation? Today, he was very explicit in saying, we're not looking at retaliation. They're still talking to the United States government. Donald Trump last night said he was not happy with 3M. They could push back as much as they wanted. This was the way it was going to be. But then late last night, the White House sent a statement to CTV News saying that this would not apply to countries where there is a direct U.S. national interest in allowing the masks to go. And that has been the argument that Chrystia Freeland has been making, and that I expect the Prime Minister is likely going to make too, that it's in U.S. national interests to make sure that the Canadian system is stable, that healthcare here is good, that we're able to continue to provide them with things like pulp to make those paper masks or nurses to work in their healthcare system. So I think they're still working that out. He's trying not to inflame Donald Trump, would be my guess. That tends to not be a good move, while still standing up for Canadians. So we'll see exactly what happens with this going forward, Robin. But at this point, 3M did tell Canada yesterday, in fact, the procurement minister talked to the CEO of 3M, that no masks have been delayed or diverted at this point or canceled for Canadian shipments.
Okay, Mercedes, stay with us. We're going to bring in our chief political correspondent, David Akin. David, what did you make of all this talk with the 3M masks?
Well, I think among other things is the Prime Minister did say right at the beginning that 1 million masks are en route right now to Canada in the next 48 hours. And unfortunately, I mean, it's a limited press conference. He did not describe what kind of masks are en route. Are they N95 equivalents? Are they surgical masks? And where are they coming from? We would have liked to have heard more information on that, I think. He also said that as Canada attempts to get this supply chain system set up globally, that Canada, the federal government, has leased a warehouse in China in which they will collect equipment being manufactured in China to be shipped here in Canada. I think that's important because over the last 24 hours, we have heard that the United States has somehow hijacked a shipment of N95 respirators bound for Germany that were in Thailand. So here's a shipment in Thailand going to Germany, and the U.S. has somehow intercepted that shipment. So Canada taking steps now to lease its own warehouse and presumably provide its own security for any gear it gets from China. And again, the Prime Minister saying Air Canada and Cargojet have been contracted to make sure that gear gets here. But again, we'll certainly be following up, and we'll have these reports later on our website about 1 million masks are en route from somewhere to Canada in the next 48 hours, but we don't know what kind of masks those are, and that's an important detail to figure out.
And yesterday we know that Ontario released its projections, and they're very worrisome. But again, he seems to be avoiding that question. What do you make of that, Mercedes?
Well, I think, Robin, that there's a lot of questions we're still trying to get to the bottom of. And we have this press conference every day, which is great because it's not often that we get to ask the Prime Minister so many questions every day. But one of the sort of challenges and frustrations has been that we don't necessarily get an answer to those questions. That's not unusual with politicians, but I get a lot of viewer mail about that. So we certainly are trying to press and to ask questions, and sometimes I think they're still working through their answers. It's really an evolving situation that's going very quickly. Today he was asked about the masks. He was also asked about testing and whether there is enough of that and whether we have an accurate picture. He was asked about the modeling, and he won't really say why they won't release the federal models. And he's talked about the provinces having to release theirs first, and each province does it differently. That's something I've heard from sources behind the scenes too, but those same sources say public health has a sense of modeling. You look at other countries and you have a sense of projections, and they've been very reluctant to release those projections. And they are going to do so eventually. We still don't know what day. It sounds like it's getting closer. We still don't have an answer on ultimately whether they are going to change their guidance on masks. So far, they've been saying, you can wear them if you want, but don't wear a surgical mask or an N95 mask, because those are really needed for people on the front lines. If you want to wear a mask, you can make one at home with a simple pattern, cut it out, and choose to wear it. But that's a personal choice. So we're still really kind of digging around trying to get information on so many subjects, Robin. And I think sometimes that's because the answers are still evolving as we go.
David, he was asked about
Robin,
testing. Yeah, go ahead.
Sorry, Robin, I just want to chip in and just amplify what Mercedes says just on this data. The Prime Minister today was actually quite direct, and he's hinted at it in previous days on why not a federal model and kind of throwing it back at the provinces. Ontario has good numbers, BC has good data, Quebec presumably has good data, but the ability of provincial health authorities very significantly provide accurate data. And that was the Prime Minister said, before we can put out any federal numbers, we need better provincial numbers. So again, kind of throwing it back at provincial capitals to get some of this data together.
David, I was going to ask you about the testing question. He was asked, should they have started it earlier? What was his response to that?
Right, and I guess he sort of says we're doing a lot of tests. I mean, that was, as Mercedes said, the classic politician response, sort of saying, oh, we're doing a fine job. We know that testing ramped up quickly in BC. Again, it's provincial authorities really who have a lot of the responsibility here, and that's the way our system is set up. Ontario got on board, and Quebec is kind of getting on board. But certainly, South Korea is the big example where there was absolutely mass testing, and South Korea's curve has remained flat, and a lot of people chalk that up to testing. So a legitimate question, but perhaps also here, this is a problem of our federation. It is not up to the federal government to initiate testing programs. It's up to provincial health authorities to do that sort of work.
And finally, Mercedes, let's talk about the fact that different levels of government are talking on the American side and the Canadian side. Trudeau seemed to indicate that the dialogue is still open, right?
Oh, yeah, the dialogue is definitely still open, Robin. They're still talking. This hasn't closed. The decision hasn't been made. They have to talk every single day to try to manage this relationship, because neither country can afford for it not to be managed. But there are still some key questions, and it's not just the masks. It's also about keeping essential workers able to cross the border. But some people want that tightened, Robin. They think there's still too many people designated as essential, and that it risks spreading coronavirus.
All right, thanks for that, Mercedes. Let's recap what we heard from the Prime Minister today. He spoke about modeling scenarios, saying his government is waiting on more data before releasing forecast models to Canadians. But he reiterated our actions can change any projections. He confirmed millions of masks will be arriving on a cargo flight within the next 48 hours, and arrangements are being made to import other much-needed medical equipment. Ottawa continues to be in discussions with the Trump administration about any disruption to shipments of essential items, especially those N95 respirator masks and other medical supplies. But the Prime Minister says he's not considering any retaliatory measures. And finally, the Prime Minister reminded everyone it's the lives of your loved ones at stake, the lives of the people your neighbors love. It's the lives of the people who are still on the job. From hospital workers to grocery store clerks, those are the lives at stake. So it's all up to us to do our part by staying home, washing your hands, and taking steps to prevent the spread of the virus, even if you don't have it. And you can find full details on globalnews.ca and tonight on Global National.